It used to be that most babies born with congenital heart disease did not live to see their adult years. That has changed thanks to medical advances in treatment and diagnosis. Still, it sadly remains a relatively common birth defect for parents, children, and the adults they become. Joining us now for their insight, Krista Vrend. She is president of the Canadian Congenital Heart Alliance. Dr. Erwin Uxlin, cardiologist and director at the Adult Congenital Heart Disease Program at the Peter Munk Cardiac Centre in Toronto, and Kathy Rizzo. She is the parent of a child who's now 13 years old, born with congenital heart disease. And it's good to welcome all of you to TVO tonight for an important discussion about something that affects, sadly, way too many people. Let us, Krista, I want to start with you first.
Sure.
You've got this, eh?
I do.
You've got congenital heart disease.
I do, indeed.
Since when?
Since birth.
You were born with it?
I was born with it, yes.
How old were you when you had your first surgery?
My first surgery, I was 6 months old. I had another one at 3. I had my first open heart surgery to actually repair my defect at 6, another one at 12. And then as I moved into adulthood, I had a pacemaker and a couple of minor repairs done.
So what are we up to now, 7 or 8?
Yeah, something like that. 6, I think, 7.
6, 7 surgeries?
Yeah.
How do you feel right now?
I feel good. Yeah, I feel really good.
Well, you look fine. You've got a big smile on your face, which is not what one might expect after that many surgeries.
Yeah, well, you know, listen, it's something that I was born with. I've never really known anything else. It's something that CHD patients live with their whole congenital cardiac disease, congenital heart disease, sorry. And it's something that you live with and you learn to live with from birth, and it's a part of you. It's part of who you are. It makes up part of who you are. You
said that they did their first surgery on you when you were 6 months old?
Correct.
What did they actually do?
So back when I was born, which was a little while ago, they didn't do the surgeries, the open heart surgeries that they do and can do now because of medical advancements. So it was really about repairing, trying to put a stopgap in place so that I could get to grow up and be big enough to sustain an open heart surgery.
What was wrong with your heart, though?
So I have what's called tetralogy of fallout, and that is I was born with a hole in my heart between my left and right ventricle. I was also born with a dysfunctional aortic valve and a blockage in my pulmonary artery.
Oh my goodness. That really sounds quite desperate.
It does. It does sound desperate, and I'm sure my parents certainly went through a lot when I was born. But, you know, the Sick Children's Hospital is amazing, and they do amazing things here in Toronto. And I was very lucky to be here. And you know, I have older siblings, and had I been born when my oldest brother was born, I might not have been so lucky.
Because the advancements may not have been in place.
Absolutely.
Have you got like just the world's coolest scar going on?
I do. I have quite a few, actually.
You have quite a few.
Yeah.
Well, I mean,
of course. Yeah,
I've
got one right here, down the middle. From here, it goes all the way down to here. Got some fun little zigzags going on down here. I've got a pacemaker scar here, and then I have 2 scars that go from basically my side and wrap around my shoulder blades. That was when I was 6 months and 3 years old. My dad actually says that those are where my wings were cut off.
Nice line, nice line. Good. Okay, thank you for sharing all that.
Of course.
You ready to go?
I'm ready to go.
Tell us about your daughter. When did you find out that she had congenital heart disease?
My daughter, Izzy, she was born, and we had, it was a high-risk pregnancy. So there were quite a number of ultrasounds that took place through the process, but it was never detected in utero, and it is detected now in utero, so advancements are so important. So she was born, and she was born with a heart murmur, and that's how it started. So they detected the heart murmur, and slowly, not slowly, quickly, they discovered that it was actually quite a serious heart defect. So they rushed her to Sick Kids Hospital. She was born at Women's College Hospital. So fortunately...
She's 13 now?
She's 13 now.
And had her first surgery when she was how old?
10 days old.
10 days?
Yes. So they did keep her alive for 10 days through a steroid. She also has tetralogy of Fallot, but her pulmonary artery was completely obstructed. So there's no blood flow through that pulmonary artery. So they did keep her alive through the steroid. And then the team decided, as they planned their surgery, and then at 10 days, They decided she was 2.2 kilos. Her heart was the size of a
Sorry,
walnut.
2.2 kilos.
Yes.
For those of us old enough to remember imperial, that's what?
I think it's 4 point something pounds.
4 or 5 pounds, something like that?
Yeah. So
Okay.
she was
and
tiny.
How'd she do with the surgery?
Phenomenal. It was 10 weeks. We were in the hospital for 10 weeks. So there were a few little, you know, everybody has their path.
Mm-hmm.
And there's been no intervention since. So at the time, we were told that she would have her second open heart surgery by the time she was 3, and she's 13.
And hasn't had it.
Hasn't had it yet. So we are expecting in the next couple of years, yeah, it is amazing, in the next couple of years to have that pulmonary artery replaced, because it's just,
But let me just clarify.
Old.
She had surgery at 10 days, was in the hospital for 10 weeks, so you didn't take your baby home till she was 10 weeks old,
Yeah.
but she's had no surgery since.
No, yeah.
Wow.
Yeah. So it was a miracle. Nothing short of a miracle what they do at Sick Kids.
Shall we go to the miracle worker here?
Yes. Yeah.
Okay, Dr. Irwin, tell us about some of the advances that have happened in these kinds of surgeries since she was born and her daughter was born.
So these stories are very typical for babies born with congenital heart defect. About 30% of the babies born with a congenital heart defect need an operation or procedure to the first hours, days or weeks of their life to survive. So 50, 60 years ago, there was a natural selection of the patients. They didn't survive, or many of them didn't survive because there was no treatment available. But now in 2018, 90 to 95% of babies born with a complex congenital heart defect are surviving now, and they are surviving until adulthood.
This is in Canada or where?
That's in Europe, North America,
So in the
Japan.
developed world.
Yeah,
Okay.
And so due to advances in imaging, advances in congenital heart disease surgery, advances in interventional cardiology, the cardiologists and the surgeons now understand the complexity of the congenital heart defect. They have figured out how to redo the plumbing of the heart so that the journey of the red blood cells through the lungs and through the body allow the patient then to survive.
Let me follow up with this, because
The
Kathy
key
said...
passage is these hearts are only repaired, even though she has a good quality of life, she has excellent quality of life, but their heart is not cured, it's not fixed, it's only repaired.
I see. Okay, let's put some information up here, shall we? Sheldon, bring this graphic up if you would here. This is the story of congenital heart disease in Canada. 257,000 Canadians have been diagnosed with congenital heart disease, and 2/3 are adults. 1 out of every 100 babies born in Canada have some form of congenital heart disease. Now, 1% doesn't sound like very much, but of course, in a country of 35 million people, that adds up. I want to follow up on something Kathy said a moment ago, which is that you can now diagnose congenital heart disease in utero.
Yeah,
Do you have to wait until the baby is born to do something about it?
No, so newest technologies allow us now also to do intervention in utero so that the fetus and the newborn can survive.
But to operate, you have to wait until the child is born, I presume.
That's correct. You have to.
And then you can do it right away because you know?
So, yeah, so some babies need an intervention during the first hours after birth so that they can survive. These are very, very challenging operations. Usually, the baby's circulation of the lungs is impaired, so there's not enough blood flowing through the lungs, so the babies are very blue, they're very cyanotic.
That's what I would have wondered. Like, you can do open heart surgery on a brand new baby.
Yeah, so what do the surgeons do? They create the shunt. They create a communication between the systemic circulation, the pulmonary circulation, so they redirect blood from the aorta to the lungs, so that more blood is offered to the lungs, and then you have a better oxygenation of the blood, and then the babies are less blue. And then this gives us a time window for the baby to survive, to grow, and to 1 year, 2 years, or 1 month, 2 months, and then the surgeons can then do open heart surgery and repair the congenital heart defect.
Let's do one more follow-up here. We've seen surgeries over and over and over, and we've seen with her daughter just one surgery in 13 years. How long typically does a surgery last for?
This depends on the congenital heart defect. Every congenital heart disease patient is different. So you cannot generalize and apply a general recommendation to all patients. Every patient is different.
You have a particular type of heart defect, but how do you know how many there are in total?
Oh my goodness. I think there's quite a few, and even as you've seen within one category like tetralogy of fallout, there's different variations of it, the defect, and the heart malforms in different ways. So I think it's, you know, tens or hundreds potentially, but yeah.
Do you know if you are finished with surgery for your life?
So I'm not entirely finished. I do still have a dysfunctional aortic valve because of some of the construction of my heart. They weren't able to replace it when I was younger. So right now it's really just, you know, the most important thing about making sure that you continue with care and specifically congenital cardiac care as you get into adulthood is because problems can arise. And the earlier that they catch those problems, the better shape that you're in health-wise to actually go through those surgeries, recover from them.
Sure.
And it's a balance. It's a balance between, you know, when's the right time to do it while you're still healthy, but you know, let's not do it unnecessarily either.
Do you anticipate needing a new aortic valve at some point?
At some point, that's the expectation, is that I will, but so far so good. So.
Good. How is now, you know, we sort of touched on this a little bit, but I want some more information on this. You seem fine. You seem perfectly, if this is the right word to use, normal. That you can do anything anybody else can do.
Yeah.
Is that in fact the case?
You know, I definitely have limitations. I couldn't go out and run a marathon. I can't, you know, I can't do really high impact cardio activities, things like that. But you know, for the most part, I live a healthy life. I have to be careful, watch my weight, as anyone should and does.
But what do you do for exercise? You can't play hockey. You can't.
I can't play hockey. I can't run. I don't jog. But I do things like I go downhill skiing. I do yoga. I rock climb. Yeah.
Rock climb?
Yeah.
That sounds more dangerous than the surgery. Anyway, how about for your daughter? What kinds of limitations, if any, has she seen in her life?
She really self-regulates. So when she gets tired, when she gets the burning in her chest, when she feels her heart rate is when her heart's beating too rapidly, she'll just sit out or start walking. If everyone's running, she starts walking, and she really has learned to self-advocate and self-regulate. So,
but she's 13, right?
Yeah.
So this is the age when kids want to go on ski weekends with their friends or play field hockey, or she does ski.
She skis.
Skiing's okay.
She taps. She dances, jazz, hip hop, all that cool stuff.
Break dancing?
Break dancing. All
she
that,
can do that?
Well, you know,
maybe not that.
Her style, right? She does ski. She skis. She plays the saxophone. She plays the alto sax, which is, as a parent, I see it as a way for her to build her lung muscles.
Lung capacity, for sure.
Yeah. So I'm so happy that she chose that instrument, and she loves the instrument. So it's a win-win.
I actually played the alto sax at her age as well.
Do you?
Yeah, that's hilarious.
That's cool.
You still play?
No, no, that was in school. I'm not overly musically inclined that way.
But that requires a considerable amount of lung capacity to play that instrument.
Absolutely, and it's definitely something that, you know, as you're going through recovery, it's something that's really instilled in you, that you really want to build up lung capacity. They do a lot of exercises with you coming out of surgery around that to increase that.
Right.
So.
Kathy, your daughter, how often does she require kind of, you know, follow-up doctor visits, treatment, that kind of thing?
Every year. Every year we go to Sick Kids, and she has, now, she has an MRI, an annual MRI, stress tests, ECG, echo. So it's a full round.
Full thing.
Yeah, it's a full day affair, usually a 2-day affair. And then
how satisfied or not are you with the kind of treatment she's been getting?
It's phenomenal. It's incredible treatment. It's really, Sick Kids is the Rolls Royce. That's, you know, a parent said that to me once early on in my journey, and absolutely, it's the care from the doctors, but the nurses are phenomenal. It's the strategy. It's a whole family affair, and it's a holistic approach to their health, which is they take care of her physically, but emotionally, and it's amazing. It really is amazing.
Now I got to ask you, Dr. Irwin, because you know, SickKid's a world-class hospital with a great reputation, but it's one of a kind. If you don't live in Toronto, let's say you live in Eastern Ontario or Northern Ontario or Southwestern Ontario, what kind of treatment are you going to be getting there?
Actually, Canada is one of the best organized countries to provide care for patients with congenital heart disease, even adults with congenital heart disease. And there is an organization across Canada, it's the CATCH network, the Canadian Adult Congenital Heart Disease Network. And there are 5 super-regional congenital heart disease centers from east to west, Halifax, Montreal, Toronto, Edmonton, and Vancouver. And then there are regional ACHD clinics. Toronto is the hub for adult congenital heart disease.
Where else are they in the province of Ontario?
Yeah, we are the hub for we are a provincial resource center, but we are also a national resource center. We are receiving referrals from Halifax, from Newfoundland, from Winnipeg, if the patients need a special procedure or a complex procedure. And as we heard, these patients are getting more complex and more complex. So not only the number of patients is increasing, but it's also the complexity which is increasing.
But if you live in Thunder Bay or Sudbury or Gravenhurst, you know, what do you do in that situation?
Okay, so our patients have an annual appointment. We see them every 2 years, even from Northern Ontario. They are traveling south to Toronto.
Okay.
But what we are doing now, we need to reorganize the care for these patients, because in Toronto we cannot see all these patients because we don't have the capacity and the resources. So I'm working now on a shared care model so that we share care for patients in Northern Ontario. For instance, we have close collaboration with Sudbury or with Thunder Bay. That's the plan, so that patients don't need to travel to Toronto every year. Okay. They are seen by the cardiologist up north every year, but we see them every 2 to 3 years as needed. But there has to be very close collaboration, communication with us so that we can provide quality control.
Sure. Can I ask you an even more personal question than the ones I've already asked?
Sure.
Do I have this right? You've got a kid?
I do, yeah.
6 years old?
He is 6.
So pregnancy is not an issue then?
So it wasn't for me. Certainly growing up, I was, you know, it wasn't a sure thing. It wasn't something that I was, you know, I was told, you know, maybe, maybe not. Err on the side of not because of my condition. But again, medical advancements, medical technology is a wonderful thing. And so I was high risk, but I was able to have a very good pregnancy. You know, it does come with risks for my son, who had a higher chance of having CHD because of me. Instead of 1 in 100, which is the regular stat, it was about 1 in 15 chance.
1 in 15?
Yeah, yeah.
Those aren't great odds.
Yeah, they are not great odds, but again, you know, they looked at his heart while he was in utero, and everything was great, and he was born very healthy.
So he's fine?
Yep, he's fine.
No evidence whatsoever of
no.
the condition that afflicts you?
No.
That's terrific. Can you tell me, just follow up on that a little bit in terms of pregnancy? Is it advised or not advised to get pregnant if you have?
So that's another challenge of adult congenital heart disease. Many female patients now have reached their childbearing age and they want to start a family. The key question is it safe for the mother to go through pregnancy? And what is the risk for the fetus? So most patients with a congenital heart disease, they can go through pregnancy. There are some defects, or some patients who should not get pregnant, but most of the patients can go through pregnancy with an acceptable risk. But the risk in most of the patients is increased. And in Toronto, we are very lucky to have a specialized clinic, the Specialty Pregnancy Program at the Mount Sinai Hospital with a specialist, cardiologists and obstetricians who counsel these patients before pregnancy. That's the ideal situation, so that you discuss with the patient and the partner what's the risk of pregnancy, what's the risk for the mother, what's the risk for the fetus. And then you establish a plan to go safely through pregnancy.
Can I ask another semi-macabre question here?
Sure.
Do you have the same life expectancy as anybody else?
For the most part, yes. Yes, I do.
Have doctors told you anything about how long you should expect to live?
No.
No.
Nope.
So you play your cards right and you're just like anybody else?
Yeah, absolutely.
Okay. Should we play this now? Let's do this. Sheldon, we're going to see your daughter.
All right.
Okay. This is Isabella and a video that she made. Now, I think she was 11 when she made this, right? Mm-hmm. This is an animation that she did when she was 11 years old. Mm-hmm. And we hear her voice.
Yes, that's her. Yep.
Good enough. Let's play it.
I'm 11 years old, and I was diagnosed with a congenital heart defect, or CHD, when I was born. CHD can affect the heart shape, how it works, or even both. Each year, about 1 out of every 100 babies born has a heart defect. It is the most common birth defect, and over half of the affected babies born are at serious risk of dying without surgery to correct it. That was me. 21% of children require cardiac surgery under 1 month. That was me. 41% of children require cardiac surgery under 1 year old. That was me too.
She's very creative.
That's
well done. Is that what she looks like, incidentally?
She's cuter.
Why was it important for her to make that video?
She was asked to speak about her heart and speak about CHD, and she's shy, but she also felt it was very important to talk about it. So I'm a teacher, so we kind of put our heads together, and I showed her that outlet, and she took it, and that's what she produced with it. So she's pretty amazing.
Dynamite.
Yeah, fantastic kid.
Again, can I ask a bit of an awkward question?
Sure.
Have you had conversations with her about things like life expectancy and that kind of thing?
Right now, no, not about life expectancy. We take it day by day and year by year. And that's right now, we're just focused on, she has 2 tests today. That's why she couldn't make it, by the way. So we're focused day by day, right?
Oh, so she was planning
She's
to be
just a
here.
normal kid, right?
Okay.
And so we talk about it when we see her cardiologist. Her cardiologist is amazing and speaks very frankly with her. But it's one step at a time, right? It's all about managing it.
Because I presume at some point she's going to need further treatment.
Yes, so we do talk about the fact that she will have full repair done again. She will have open heart surgery. Her artery will be replaced.
Which she can't be looking forward to.
No, and it's very scary. So we have to manage that. We have to talk about it, but talk about it in a really healthy way, in context, knowing that there's a huge support team. We're fortunate enough to live in Toronto, so she's going to have her family, her friends, on top of the medical staff. I do want to say, though, that for parents who do live in remote communities or outside of Toronto, it's very difficult for them. Many of them find it very difficult. There's an economic stress. There's financial stress of getting down to Toronto, being here with their child. There's a lot of organizations that do support these families, and Ronald McDonald House also supports these families. Mm-hmm. But when they're kids, they need their parents and they need their family. Yep. So it's important to support. It's the whole network that needs support.
I want to ask you, you're Swiss, right? You're from Switzerland originally? Yes. What'd you come to Toronto for?
Actually, I trained in adult congenital heart disease in Toronto in 1996 and 97. I spent 2 years in Toronto to get trained in adult congenital heart disease. And even at that time, Toronto was a global hub to get training in adult congenital heart disease. Then I went back to Zurich, reorganized the ACHD program in Zurich, but then an opportunity became available in 2005 to be the director of the adult congenital heart disease. And the Toronto Congenital Cardiac Center for Adults is one of the largest and oldest ACHD program in the world. Huh. The first clinic opened in 1959. So it's quite challenging. We have one of the largest populations. We have about close to 20,000 patients in the database, and we're actively following about 9,000 patients. So that's the challenge. Number two, Toronto has an outstanding team, multidisciplinary team of physicians providing care for the patient with empathy and dedication.
I want to give you the last word, because I think probably a lot of people going through their daily lives kind of take life for granted, and I bet you never do.
I don't, you're right. It's true. I think, again, you know, I don't know anything different, but I think having CHD, congenital heart disease, definitely gives you a different perspective on life. It definitely makes you see things probably a little bit differently than someone who's fully healthy, and you don't take advantage. You know, you learn as you're younger to enjoy things that, you know, you might not get to do otherwise because of your surgeries. You really try to live life to the fullest, for sure.
Well, I can't wait to get the invitation to your 80th birthday party.
Good.
And hopefully I'll be around for that too.
Be on the list.
I want to thank Dr. Erwin Oechslin, who's got a tough to pronounce last name, but it's beautifully Swiss, the cardiologist at the Peter Munk Cardiac Center, and Krista Vrend and Kathy Rizzo, who's got the greatest Twitter handle. I don't know if we've shown it on the screen, but it's Rizzy Riz. That's a good one, Kathy Rizzo. Good stuff. Thanks so much, everybody, for coming into TVO tonight.
Thank you.
Appreciate it.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.